Hi everyone, my name is Ramya Radhakrishnan, and I am affiliated with the University of Miami Health System. My assigned topic was to investigate why Asians and Pacific Islanders are disproportionately impacted by hepatitis B. With HEPA meaning liver and itis meaning inflammation, one can infer that hepatitis B, or HBV, is an infection of the liver that leads to inflammation. However, many people do not know that it is one of the most common causes of liver disease worldwide. Hepatitis B can cause irreversible damage, including severe scarring, which is known as cirrhosis, and even liver cancer. It is one of the deadliest infections worldwide, with an estimated 2 billion people worldwide having positive blood markers of past or present infection. HBV can be spread through bodily fluids and infected blood products. Therefore, some of the most common ways of spreading this virus include childbirth and sharing of infected needles, for example, while using drugs such as opioids, which result in lifetime infection. One of the most dangerous features of hepatitis B is that it is often symptomless for long periods of time, which is why it is referred to as the silent infection. For this reason, it's extremely important to be tested for the virus if you engage in high risk activities, if someone in your family has the virus, or if you are from a country where HBV is very prevalent, which we will discuss shortly. Testing is very straightforward and can be done at your doctor's office with a quick blood test. If you do test positive for HBV, it can easily be treated with an effective antiviral pill, which will directly stop the replication of the virus and prevent complications like cirrhosis and liver cancer. Now, you might be asking, what areas of the world have a high prevalence of hepatitis B? Strikingly, a whopping three-fourths of the infected population is from Asia and the Pacific Islands. Now, why is this the case? Historically, the rate of immunization for newborns against hepatitis B has been significantly lower in Asian countries, such as China, Korea, and Japan. This is partially due to large rural populations where access to healthcare may be difficult, vaccines may not be readily accessible, and a large proportion of childbirths occur at home. Newborn babies born from infected mothers should be given the Hep B vaccine immediately after birth, which is usually the case in a hospital setting. However, women who have home births in rural areas are less likely to have access to this care. For this reason, most Asian adults with hepatitis B contracted it from their mothers, and this is why it is common to see several infected individuals in a family. Another key contributor to the high infection rate in Asian countries is the increased practice of holistic medicine techniques that involve needle use, such as acupuncture. As we talked about earlier, if needles are not sanitized and disposed properly, Hep B can be transmitted. This lack of adherence is common in areas with lower health literacy. Finally, the best way to control hepatitis B infection is to try our best to prevent it. For this reason, the HPV vaccine is recommended for all people. The vaccine is safe and cannot give you hepatitis B, a myth that is very important for us to dispel. Policies are currently in place that mandate the vaccination at birth, but it is important to screen high risk individuals and pregnant women for this virus and administer the vaccine if they've not had it yet. With this presentation, we hope that we can raise awareness regarding the importance of screening and treating hepatitis B, especially for individuals in the Asian and Pacific Islander communities. Thank you for your time.